What's going on, guys? It's Mike back with another video. So what I want to talk about today is probably the most significant thing that I've struggled with in TRT. It's been a couple months. You guys have been sending me a lot of requests to make a new video, and I get a message here and there. It's not a ton of you, but it's more than one. So, is high and low estrogen, and there's absolutely nothing more important to the success of your TRT regimen than your estrogen levels. And I never realized that going into TRT. I always just thought everything was controlled as far as how you feel was by your testosterone levels. And I think a lot of doctors believe that too, which is why it's constantly overlooked. You find almost nothing on the internet to help you with this. A lot of endocrinologists don't even know. A lot of endocrinologists don't even believe in TRT. They simply just specialize in diabetes and things of that nature, or I think thyroid issues fall into endocrinology as well. So I have a list of side effects that I'm going to read to you. And I want you to consider these side effects. They're, for the most part, pretty accurate, and I think everybody will notice different things depending. And to be honest with you, when I have bouts of high and low estrogen, the symptoms change frequently. As far as one time I'll have low estrogen, or one time I'll have high estrogen and I'll get a lot of acne. And the next time I have high estrogen and I won't get a lot of acne. And it throws you off. And then sometimes you find yourself in a situation where you don't know if you have high or low estrogen. And some people are going to struggle with this so much more than others. But if you're on TRT and you're on a reasonable dose, I would say anything above 80 milligrams per week, and you don't feel well or better, and it was determined you had low estrogen before, or testosterone, if you determined you had low testosterone before, then you have estrogen problems. And it's simple as that. And you'll go into the doctor and they'll say, oh, well, clearly this isn't working for you because everything is where it needs to be. They won't even test your estrogen or your cortisol. I mean, we'll make a whole nother video on that. Because they just simply don't think it's necessary. And then you hear stories of people getting turned down, getting anti-estrogen drugs such as Arimidex, or that's probably all you should be getting from a doctor. Anything worse than that is going to be more powerful, and it's not really needed. But doctors will say things such as, "I'm not going to prescribe you a drug for breast cancer patients. If I have high estrogen, you can't give me the drug that it takes to lower high estrogen. To bring it into normal range." But more than likely, if your estrogen's high, you're probably taking too much TRT anyway. And ideally, you want to find that reasonable spot where you don't need to take an anti-estrogen, where you're taking just enough that your body demands. And that's what it is at the end of the day. You're simply replacing your own production at this point, which is now lost for whatever reason, whether it could be head trauma, whatever reason you have hypogonadism, whether it's secondary or primary. But you're simply just replacing that testosterone. And, in theory, when that testosterone is replaced at the proper level, which can sometimes take years to find through trial and error, you shouldn't have any estrogen issues. Your estrogen should fall right in line. And if you're taking too much TRT, you're going to have higher estrogen. If you're taking too little, you're probably not going to have low estrogen to where it affects you. But where you start to find yourself in a tricky situation is when you prefer to take a little bit higher, right? People prefer to have optimal levels of hormones. Having high testosterone is essentially masculinity. So everybody wants to be on the higher end, right? So it's and that's your prerogative, and with your doctor's supervision and approval, that's something that you can do, but you're going to end up needing to take an anti-estrogen. So let's talk about some of the symptoms. Now, one thing you're going to notice is they're very, very eerily similar, but there's some ones that stand out very specifically, and we'll get into that. So with high estrogen, you're looking at acne, loss of libido, water retention, so you're getting bloated, Pissing less water than you consume. Moon face, you get a big old puffy face. That's a common one for me. Small testicles. Scrotum hanging too high. Soft testicles. Extreme oiliness all over. Aggression, depression, bitchiness, lethargy, insomnia, soft erections, extreme cravings for sugar, high blood pressure spikes, enlarged prostate, pressure in lower abdomen while urinating, thin stream, constipation. Okay, now listen to low estrogen. Dry skin, dry lips, dehydration, loss of libido, that's a repeat. Good morning wood, no wood when it's time for sex. Loss of wood while having sex. Loss of sensitivity, dry gland, aka penis. Loss of girth, irritability, mood swings, crying for no reason, DHT rage, dull orgasm, hesitation before urinating, night sweats, loss of appetite, constant fatigue, lethargy, constipation, itchy scalp, obsessive thoughts. So, on the initial onset, for me, and I have absurd amounts of experience with low and high estrogen, and I have this, some people they'll experience symptoms and they're not really sure. And usually for the first 3 days, 2 or 3 days, I have a hard time deciphering. But there's one in here that I want to hit on. When I know I have high estrogen, a couple things I always look out for personally is the bloated, okay? Where you look in the mirror and all of a sudden you're looking a little puffier than you usually are. And one thing I notice is my hands. I can feel water retention in my hands. And when I grip my hands like this, they feel fatter than usual. Almost like I got something stuck in my fingers. And oiliness all over. And acne is a big one that I get when my estrogen's on the higher end. And then probably the one that affects me the most, and probably will affect all of you the most, and you kind of experience this on both high and low, but a little bit differently on each one, is depression. You will get these I tend to get these very intrusive, depressive, extremely depressive thoughts when I have high estrogen. And I just have absolutely zero motivation to do anything at all. Now I have the same thing when I have low estrogen as well, but with low estrogen it tends to be more of like a zombie depression, if that makes any sense. You're much less affected by it when your estrogen's low, in the sense that you're just like, you don't have much care. But when your estrogen's high and you're experiencing that high estrogen depression, you're gonna feel very wanting to do something about your depression, if you know what I mean. Very suicidal, if you will. And certainly in the event that suicide is something that you feel you're considering, please, reach out to someone and handle that. It's not something you ever want. And it's crazy because when you're in those moments, you feel like killing yourself really is the only solution. And it is terrible to say, and then you come out of it and you almost laugh at yourself that you even felt that way. And that's why it's so important that you hold on to your mental stability during those times and try to utilize some type of logic to feel your way through that depression and those suicidal thoughts. Because certainly, when you are feeling normal, constantly remind yourself that during those times that you need to be strong, because it's not really what you want, obviously. Now, low estrogen, my biggest indicators are itchy and dry scalp. And for some of you who are DHT or prone, male pattern baldness, what you're going to tend to see is you're going to see a little bit more hair loss. And the reason you see that is excess testosterone gets converted down one of two paths, or both paths really, but that is DHT and estrogen. When you're blocking those aromatase enzymes from converting your testosterone into estrogen, you're essentially only allowing that excess testosterone down one other path, and that's DHT. And elevated DHT is what causes hair loss and aggression and acne in some people. To me, I get a lot of acne in my back and shoulders when I have high DHT. And then, but obviously it varies from people to people. Some people get really bad dandruff when their DHT is high from low estrogen. And dehydration, dry lips, dry skin, those are all very important. You'll tend to look a lot leaner as well, but your muscles are going to be very soft, and you have very, 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 very low stamina in the gym. And anybody on TRT should not have any issues in the gym as far as lifting. If you have issues in the gym and you're on TRT, lower high estrogen. So, let's see, what else? Loss of appetite's another big one. And constant fatigue. And another big one is obsessive thoughts. I tend to always think that my girlfriend's cheating on me when my estrogen's low. And I go in this bit of a paranoid, obsessive state. I feel like I gotta follow her around everywhere. I mean, I don't, of course, but usually by the time I start feeling that way and having those thoughts, it's too late. That's when I have that realization, oh shit, my hormones aren't exactly where they need to be. So, and if you are struggling with your estrogen levels and you do have an anti-estrogen on hand, it's very important to be very moderate in your dosing as far as controlling that estrogen. If you're taking too many anti-estrogens or Arimidex, obviously when your estrogen's high, your natural inclination is to start popping pills to control it and get yourself to a stable point. But let me tell you something, it'll swing right in the other direction as fast as you felt good again. And that's not what you want. You're gonna find yourself bouncing between low and high, and that is a very, very difficult place to be. When your estrogen is high, it's easy to control. You lower your dose of testosterone if you're not taking anti-estrogen, or you take an anti-estrogen in a moderate dose. You find out where your tolerance is. If your estrogen's low, you're fucked. It can sometimes take 8 weeks, especially if you're taking things such as aromacin, which is a suicide inhibitor, which is killing off your aromatase enzymes. At that point, you have to wait for them to recover and come back. And recovering from low estrogen being in low estrogen for more than a couple days can ruin your life. I mean, it really can. You're not yourself during those times. My best recommendation to everyone, stay the hell away from anti-estrogens. If your estrogen's high, lower your dose. If your estrogen's low, come off of the anti-estrogens. So, if you can avoid them at all costs, do it. Now, aromatase enzymes are stored in the fat. So if you're overweight, you're going to be aromatizing more than somebody who's very lean. Typically, this isn't always the case, right? This is a rule of thumb. There's exceptions to this rule, of course. So you might be in a situation where your hypogonadism is induced by being overweight. So, estrogen and testosterone compete for the same receptors. So when your estrogen's high, it's blocking your testosterone from doing the job that it needs to do. So a lot of times you'll feel those low testosterone symptoms to come back. And obviously if you're converting at a very high rate and you're taking a very reasonable dose, even a low dose of testosterone, and you're still converting that testosterone into estrogen, you're still getting those negative side effects, and you find yourself overweight, lose that weight as soon as possible. And more than likely, if it's secondary hypogonadism, which is allegedly a failure of your pituitary, which could simply just be a disruption of your negative feedback loop, then losing the weight will probably correct your hypogonadism right there and then. And I certainly, if you are overweight and you're struggling with TRT or struggling with your testosterone levels, I absolutely recommend that you take care of your fat first, because that could correct it. And remember, guys, TRT is a lifetime commitment. Once you start, there's no turning back. You're not going to go on TRT, raise your testosterone levels, and feel better again. Everything's good, and then come off, and then all of a sudden your body recovers. It doesn't work that way. You're essentially turning your pituitary off. Your body is no longer producing these testosterone on its own. Your testicles turn off. When you come off that TRT, if that's a decision that you decide to make, you're going to have to wait for that pituitary to turn back on again. That could take 2 weeks. For some guys, it takes 3 years. But the point is more than likely when you come off that TRT, unless you have some miraculous miracle happen, your testosterone's probably going to come back lower than when you started. So if this is a decision that you are thinking about making, think long and hard, because this is a lifetime commitment. And it's a lifetime commitment to finding the right dose that works for you. Think about it.